Good evening, everyone. I'm Robin Smith. I'm the Head of Communications at Sherwood Forest, and welcome to today's public brief, not staff brief. Over to you, Richard.
Thanks, Robin. Very strong opening remarks there. Welcome, everybody. I'm Richard. I'm the Chief Exec at Sherwood Forest Hospitals. Thank you for joining us for the community update today on the 20th of January. We're doing it slightly differently tonight. We're all in our separate offices, so hopefully you'll be able to see us. Delighted just to quickly go around the virtual table. As I can see people, I've got Julie, our Chief Nurse. Robin introduced himself, Head of Comms and Engagement. We've got Dave Selwyn, our Medical Director. Claire Teeney, who's Director of People and Culture. Simon Barton, our Chief Operating Officer, and Jane Lawton here from Health Watch. Welcome, everybody. So the plan is I will just give a brief synopsis of where we are as an organisation, and then I'll hand over to colleagues to talk in some detail about what's going on. Throughout this is an opportunity for people to ask any questions. Obviously, as we've said before, the caveat is if you say, this is my treatment plan and what's going on with it, we can't go into personal detail for obvious reasons, but we are happy to pick that up separately. But very much any generic questions or comments or areas of confusion that we can help people with, please do. Obviously, since we last met, pressure on the organisation has increased dramatically. When we last spoke, probably I would have said something along the lines of, it feels busy, but we're managing. I think that view, or the view I shared in our public trust board a couple of weeks ago, has changed slightly. So we are very busy, and we're just about managing at the moment. So just go through some of the numbers. We've now got in excess of 200 patients with COVID in our organisation across all three of our sites. As a comparison, if you go back to Easter time last year, we had about 90 patients, so we're double the numbers. And as Simon probably will go through some detail over the last couple of weeks, the numbers have increased quite dramatically, and they're fluctuating somewhere between 200 and 220 patients each day with COVID. Critical care is very busy. Each organisation measures itself against a critical care escalation level. Broadly speaking, it can move from level 0 to level 3. Of the 50% of the units across the Midlands are on level 3, and we're on level 3. You may have been reading in the papers or in various different media. The National Critical Care Plan has 3 elements to it. So the first bit is about each unit moving to its maximum surge capacity, and we've done that. The second bit is about working with partner organisations to do something called decompressing, so reducing or supporting organisations to move down from their maximum capacity, and we are working with partner organisations around us from that. Then the third element is about regional transfers, and it has been in the national media that with London and the South East really busy recently, small numbers of patients have been coming up into the Midlands, although I don't think any have come to Sherwood yet, and that wouldn't be in the plans. One of the big differences between where we are today and the situation we were in Easter and over the summer is that our emergency activity remains pretty high. I'm sure Simon will talk to us about that. And explain what's going on. What we are really proud of, and I think it's a really clear indicator of how effective Sherwood is with its partner organisations. Our ambulance handovers remain really strong. We know that the most vulnerable patient in any community is the patient at home who's phoned an ambulance and is waiting for them. And the key bit that we can do as a hospital provider of healthcare is to ensure that ambulance handovers take place in a timely way, and they're certainly taking place in a timely way. Sickness is about double the level it would be at normally at this time of year. That's linked into COVID and non-COVID reasons. I won't go into too much detail around the COVID vaccination because I'm sure there'll be some questions, and also Claire will update us on that. But we've been vaccinating through Kingsmill since the 8th of December. We've vaccinated in excess of 16,000 people using the key criteria that we've been asked to, and I think that's a huge success. And certainly the vaccination programme over the coming months will be a key component of us being able to reduce some of the restrictions on our personal lives. So just two final things for me before I hand over. I'll say to Simon, first of all, to give an update on his areas. Firstly, a massive thank you to colleagues, not only at Sherwood, but the other healthcare organisations, the social care organisations we work with, the voluntary sector, but also private industry. We are under pressure. I think that we're coping well, and we're coping well just because we've got so many fantastic people putting in a huge amount of discretionary effort. Something we've reflected on is we all know that that COVID has impacted massively on our personal lives now for 11 months. So when you interact with people at Sherwood or other organisations, just reflect on how difficult it has been for them over the last 11 months, not only in their working lives or their personal lives. And the second bit is a message to all of us. Whilst at times it can feel really difficult, and it can feel that the situation we individually and collectively face is on occasion sort of unmanageable, actually we've touched on the vaccination programme. I think there's other reasons why we can legitimately feel positive and hopeful and optimistic that 2021 will be better than 2020. It's likely that the next couple of weeks will be really tough. We know that the rate of COVID in our communities is increasing in a way that's been described as uncontrolled. When you've got very high rates in the community, that means that in 2 weeks' time, hospitals will be busier, and 2 weeks after that, critical care will be busier. So it is very tough, but we know that we all have an individual responsibility to do the basics well. And the basics well are wearing face masks, sanitising our hands, and maintaining social distancing whenever possible, and certainly wherever possible, staying at home and looking after ourselves. So a bit of an introduction from me, and Simon, I'll hand over to you if you'd like to add to that, please.
Thanks, Richard. Yeah, I was having a look last time we had a public Q&A. There were 91 positive patients with COVID in the organisation. That was on the 21st of December, and today there are 206 positive inpatients in the organisation. We've moved from 9 admissions a day to 19 admissions a day, and now 40% of our medical bed base is occupied by patients with COVID. So a real increase. As Richard mentioned, our critical care unit is in surge with 22 patients. That's about just over double what it would normally have. And that is hampering some of our ability to do surgery. So we're really focused at the moment on the Kingsmill site in terms of doing operations for urgent patients, those patients with orthopaedic trauma, and patients with cancer, and that literally is the priority because our critical care unit is occupying most of our theatres at the moment as part of our surge plan. Newark continues to operate. Its 2 theatres are operating as normal, so there's still a lot of day case surgery and short stay surgery happening at Newark. So thank you to colleagues over there for keeping that going. I think, as Richard said, we are trying to keep as much business as usual happening as possible. So we're treating, as well as COVID patients, we've currently got over 300 non-COVID patients in the organisation at the moment, and obviously providing effective care for them, seeing around 900 outpatients a day, not all of those in person, some of them virtually and on the phone. We still are seeing outpatients in person. We think it's important in terms of managing the risk to those outpatients, so still seeing quite a few outpatients in person, and positively delivering 9 babies a day. You know, so there's still lots going on within the hospital in terms of keeping it going. I think you might see some of our outpatient clinics are changing. And that is largely because we've got to focus the workforce on the inpatient workloads at the moment. So you might see some changes to that. We hope they will be minor, and they'll be well communicated. But the overall sort of message is we continue to do our outpatient clinics. I think that's all I really wanted to say at this point. So I'll hand back to you, Richard, and
Thanks, Simon. Can I hand over to Julie and then Dave? Anything you would like to add before we go to Claire, please?
So I think the only thing I would add is that last time we spoke to you about our compassionate visiting policy, and in view of the levels of COVID we've got in the hospital and the ongoing national lockdown, that policy remains in place and is unchanged. So as an outpatient, if you're coming into the hospital, we need you to come on your own unless you require a carer as part of that appointment, or you have been given advice that you can bring someone because of the nature of your appointment. For all inpatients, we are operating a no visiting policy unless visiting is required under compassionate grounds. We have established a family liaison service as of this week. It's been a bit harder to set that up this time because of how busy the whole hospital is, but that is now established and we'll communicate the contact number for that service. That's just the update from me. Thank you.
Dave?
Okay, so I've been a frontline doctor today. I was down on the critical care unit, and as Simon and Richard have alluded to, very busy. I guess lots of things I could sort of reflect on from that. I'll just bring a couple which might bring some of this to life for people. So this morning we sent a desperately sick patient in their 20s. So younger than everyone on this call from the Sherwood side, so we sent them off to our advanced respiratory unit at Glenfield in Leicester for what's called ECMO, or extracorporeal membrane oxygenation. So that's an external heart-lung bypass. So we couldn't ventilate, we couldn't oxygenate this patient. So we've done that. So that's a sort of brings it to life about actually the age of people being affected by this disease and the seriousness of it. On the other hand, we've also adopted the recent trial guidance around some of the new arthritis drugs, and we've been giving tocilizumab to some of our patients, and we've seen some results with that to help turn some of our patients around on the critical care unit. So just a couple of sort of examples of a sort of medicine, if you like, in action there. Talking to the while I was down there, talking to the support nurses, the support medical staff that we've got down there. Obviously, they're all been anxious about being redeployed to the critical care unit, but they feel well supported, and you know, they've joined the team. The team is functioning really well, and there was a real spirit down there, as you would imagine. So, but it was really pleasing to see that. So perhaps stop there, and happy to take any questions.
Fab. Thank you, Dave. Go to Claire and then Jane, please, and then we'll be guided by you, Robin.
Thanks, and thanks, Richard. So as Richard said, we have been supporting the vaccination programme through the Kingsmill site at a vaccination centre that's located here. We started the vaccination service on the 8th of December, and that was in line with the national programme. We were one of approximately 52 hospital hubs who commenced the vaccination programme at the beginning of December. And one of the reasons for that was because as the vaccine was given authorisation, hospitals already had an infrastructure to start and deliver that quite quickly, whereas people will have seen from the news and from what you know locally that some of the other vaccination sites were not sites that were already set up or running clinically, and that takes a bit of time to do. So we were asked to support the early delivery and mobilisation of the programme. Through the vaccination centre at Kingsmill, we've vaccinated over 16,000 people to date, and it goes from strength to strength. And as part of some of who we do vaccinate, we're given quite strict national guidance about where vaccines are offered and how they are offered. Absolutely, we need to manage the vaccination use, so we're really clear that we never want to waste any, and the prioritisation groups have been vaccinating health and care staff and those citizens that are over 80, so that's been the focus initially. And across Nottinghamshire, people will have picked up that of vaccination sites have also opened in the last couple of weeks to support that initial programme. I think that's where we are today. We're continuing to mobilise the service. I think the other thing just to add in from a Sherwood perspective is that we have led on the recruitment and training for a number of other colleagues to work on the vaccination programme across Nottinghamshire, and over the course of the last 8 weeks have recruited and trained over 2,000 people to support and work into those services. So the team here have really mobilised support around doing that. I think that's me by way of an update.
Fab, thank you, Claire. Jane, anything you'd like to add?
No, it's very helpful to have this update, and I think people will be reassured to hear that it feels like, although pressure is really, really high, it feels as though you're managing it, which is really positive. I wonder if I might just raise a question which I know a lot of people will be thinking of. So great news about the vaccination, but people are aware that there's quite a lot of transmission of COVID within a hospital setting. Be interested to hear to what extent that's a problem at Sherwood, and how many staff have we got vaccinated now, because obviously they're a potential source of that transmission. So just a little bit more about the vaccine in terms of, are you likely to get it if you come into hospital from someone else, be it another patient or a member of staff, and how are you monitoring that?
Good questions. Who wants to lead on that? Dave, you've come off mute.
Yeah, do you want me to start with the spread within the hospital? So we've obviously acutely aware of this. I think we would say that people are still much more likely to acquire this disease out in the community than within the hospital. We are actively running our staff asymptomatic testing, but what so our staff are testing themselves twice a week to try and pick up anyone who's carrying COVID without them having any symptoms. And of course, as soon as people have symptoms, we ask them to self-isolate. In terms of other sources, other patients are a source. We've recently put all of our patients into face masks. We have a number of infection control procedures that Richard alluded to, but in essence it's around the hands, face, space aspects. In terms of our estate, our patient beds are relatively far apart, and so it gives us some advantage, and we have a number of side rooms to isolate these patients. So in terms of infection within the hospital, yes, we do get patients and staff who get infection within the hospital. We manage that really very what I would describe as aggressively, in terms of Julia or I deal with the meetings, which we have a number of days a week to ensure that we're on all of the actions to minimise that, and we have external scrutiny on that to ensure that we are taking that appropriately serious. Shall I stop there on that point, Jane?
Yeah,
and then there were a few other questions.
For Claire's point, do you want anything you want to add to that, Julie? No. Okay. No. And then Claire, question: how many people have we vaccinated who work here?
So I think it's fair to say that all the frontline clinical staff have been offered a vaccination, and we're pretty confident that the majority of those have been taken up. So I don't think there's an issue with the fact that the vaccine has been readily available to colleagues that are working at Sherwood, and they have been responsive to that and have been pretty much in the main vaccinated. I think the thing to just point out is that the vaccination centre, whilst it's located at Kingsmill Hospital, it is there to support not only the colleagues that work at Sherwood, but also those colleagues working in the wider health and care system. So we've also been vaccinating colleagues from a number of other key organisations such as EMAS, and particularly we were particularly keen to work with colleagues that worked in care homes in Nottinghamshire, and from the start of the programme at the beginning of December, and we were working closely with our council colleagues to ensure that that vaccine was made available to colleagues working in care homes as well.
Thanks. Does that answer your questions, Jane?
Yes, I think that was That's fine. I've got more, but I'm aware that others might have questions on the line, so I'll be led by Robin on that.
Perfect. Just before I hand over to you, Robin, could I just tie both of Jane's points together and something for you, Julie? You didn't quite say this, Jane, but there may be a perception from some people that, okay, healthcare workers have had their first vaccine at some point. Well, in 12 weeks after that, we'll have the second vaccine, and therefore at that point, face masks, hand hygiene, etc., we can all relax what we're doing. Do you want to just tie back, Julie, if I may ask you to, just that once even people have had their vaccine, we still need people to be as diligent as they are now?
Yeah, absolutely. So whilst the vaccine is the beginning of our way out of this, we still need people to follow the rules. So hands, face, space, and stay at home unless you absolutely need to be going out for any of the reasons stipulated in the government guidance.
Thanks. Over to you, Robin.
Thank you, Richard. And thanks to everyone that's been asking questions live and in advance. I think if we stick on vaccination for a short while, we've had a number of questions about that, as you probably would expect. Julie contacted us in advance, a different Julie. Really interested in reports she'd seen about vaccines getting wasted. So obviously have a shelf life and wanting to understand what we're doing to prevent any wastage. I wonder, Claire, is that something that you would pick up, please?
Yeah, so we monitor this really closely. We've had no what we would call avoidable waste that's gone through the hospital site here at Kingsmill. So what this relates to is that with the Pfizer vaccine, it comes frozen. Once it's defrosted, it has to be used within 5 days, and you can't, that has a limited shelf life. So what we've had to do is manage the logistics around that in terms of making sure that we've used it. I'm pleased to report that on every occasion since we've started vaccinating at the beginning of December, we've never been in a situation where we haven't used that vaccine in a timely way.
Thanks, Claire. That's really clear. We've got a separate question around the second dose, which is obviously something that's been in the media as well, and a concerned member of the public who had their first Pfizer vaccine on the 30th of December and had an original date for a second jab. They're asking if we can confirm that the revised date will be within the 12-week time span that's been decided, and are also interested in what impact that might have on their level of protection sort of in the interim. Dave, is that something that you're best placed to respond to?
You're on mute, Dave.
Coming off and on. There we are. It's always one. And now I've forgotten the question. Just repeat it again, Robin. It was in terms of the second dose.
Did you not
second
hear it?
dose, yeah. Will the individual get their second dose within the 12-week period, and a bit about really what the implications of the sort of level of protection that they've got in the interim, I think, please.
Yeah, so it's a really topical question, Miss. So there's been a national instruction for us to push back the second doses. So people will be aware that the MHRA guidance on the trials suggested that depending which vaccine you had, it was 3 to 4 weeks after the first dose. The national instruction now, following review of the evidence and guidance from the Joint Committee on Vaccination and Immunisation, has been to push back to 12 weeks. And the rationale behind all of that is that you get a protection from the first vaccine, and we're trying to ensure that the maximum number of people across the country get the protection. So in terms of, it's better to have 2 million people having some protection than 1 million people having total protection, if that makes sense. In terms of that, we've had to follow that national guidance. We are scrutinised on the number of vaccines we give. We're scrutinised on the number of those, and they all have to be first doses. So we're working hard. We've obviously had to review everyone's dates and push those back, and you will get a date for your second vaccine. If you don't get a date, please contact us, and we'll ensure that you get a timely second dose vaccine.
Thanks, Dave. sticking on the vaccine if we can, another individuals emailed us in advance wanting to understand a bit more about how vaccines might be delivered at home if they are. Individual circumstances relate to an elderly person with mobility difficulties, and obviously they would find it easier if that could be administered at home. Who's able to answer that? Perhaps is that Claire?
So I can talk a little bit about that. So there is a programme in place for Nottinghamshire at a system level to have a team that will support that vaccination programme. Some of that depends on the age of the person as to when that will happen, and other things that may affect their overall health. So as an example, for those citizens that are over 80 in Nottinghamshire, everyone should have had a letter now advising them about how they can book onto a local vaccination centre, and if they aren't able to do that, some of the other routes in which they can access the vaccine. Equally, if people are already receiving support through the local authority in terms of care into their home and or through wider community services, their vaccination will also potentially be picked up through that route.
Thanks, Claire. I wonder if it's worth just covering off a couple of questions, really, just sort of explaining a bit more about how individuals at home will get an invitation to a vaccination, and we've been asked about when over 75s might receive an invite. Is that something that you would have an answer to?
So the first prioritisation by age was around over 80s, and so colleagues and citizens that are over 80 will have now received their letters. Letters are also going out to those citizens that are over 75 imminently. Some may have received those already, but that is due to happen if it's not been received over the next few days.
That's great, thank you. And perhaps just one more around vaccinations before we move on. We've only got about 15 minutes left on the time. Richard, perhaps for you, we've been asked two times in the chat box around reports in the media today about a 24-hour vaccine site here at Kingsmill Hospital. Are you able to give an update on where we stand on that, please?
Yeah, very happy to. So I think as colleagues on the call have described, a key part of this is trying to maximise the number of people vaccinated over the next couple of months whilst following the clear national criteria. Logic would suggest that by opening vaccination centres for 24 hours a day rather than 12 hours a day, that can increase the number of people being vaccinated. We know, though, that whilst that makes sense, there's equally a number of challenges to that. So having access to the vaccine in a timely way, having the people to staff the vaccine centre, and also identifying people who would be willing and suitable to come in for their vaccine outside of normal hours. So Kingsmill, part of Sherwood Forest Hospitals, along with one other organisation, has been identified as an organisation just to sense check some of this. And you're correct, Robin, that today and tomorrow we're running the vaccination centre overnight. So it opened this morning at 8 o'clock in the morning, and it'll stay open until 8 p.m. on Friday. And we just want to sense check some of the things that I've mentioned there. Just to be clear, we're still following the national guidance around who can have the vaccination. What we're looking to see here is an increase in the 24-hour period of the people having the vaccine, so not simply moving people from the middle of the day to the middle of the night. And I'm incredibly grateful for the support of people at Sherwood Forest and other organisations to roll this out today and tomorrow. And my final bit would be, I think I've maybe not said it today, but I've certainly referenced it before. I would hope that we all feel very proud about the services that our local hospitals are providing, whether it's at Newark Hospital, Kingsmill or Mansfield Community. And I think the fact that Sherwood Forest Hospitals through Kingsmill has been identified as someone to test this, I think is a testament to the safety and the quality of the services provided here. So thank you to everyone involved.
Thank you, Richard. I think we'll move on from vaccination for now, because there is a lot of other stuff going on and we've only got around 10 to 15 minutes left. Just picking up on the questions we were asked in advance, we had a question through from Joanne that I think Dave, you may be able to answer. And Joan was really interested in sort of how we record COVID deaths on death certificates. Described an individual situation where perhaps they didn't feel that COVID was the main cause of death, but that was recorded on the death certificate. And I wonder if you can just help the public understand some of how that's recorded and how the numbers are come up with.
So I think this is about the numbers of deaths reported that are attributed to COVID. Yes. In terms of what we record on death certificates, we have a legal responsibility to define what we think is the cause of death, and in terms of whether or not COVID has played a part in that. So the patients who die, and this is only patients who die in hospital, who either have COVID written on their death certificate or have tested positive, go into that figures, or those figures that are released by the government, and they're released every day. There's sometimes a lag, but it's captured on the day that people die, and it's reported, I think, 4 o'clock or so in the evening of each day. Sometimes the figures change because COVID tests will come back after a patient or has died, so it may skew that. There are obviously a number of ways of interpreting that. So if you come in with a COVID positive test and you die of something completely unrelated, you will still go down as a COVID death. So for example, if you come in having had a road traffic accident but you actually have COVID, you'll go down as a COVID death, but it's unlikely that will be the cause of death. So but there are, you know, difficulties with this, but this is what we're asked to do nationally, and obviously what we have to comply with. The bit about what about deaths outside of hospital, those are picked up in what's called the Office of National Statistics, and they're reported in a separate group. Does that answer that question?
I think it does to me, yes. Thank you, Dave. Move on to a couple of ones that that Simon, you've responded to in the sort of chat box, but I'll ask them again for people that perhaps aren't a part of that. There's a question saying, are outpatient appointments in person still going ahead?
Yes, they are. As I just walked through in the intro, they are. Our clinicians will decide whether they can do those outpatient appointments either on the telephone or through video conferencing as well. So it is part of a general offer. And there may be some reductions in outpatients over the coming weeks as we try and make sure that all our colleagues are prioritised on inpatient care for the moment. But for the vast majority, face-to-face outpatients are still happening.
Thank you. And the other one you answered in the chat box was around cystoscopy, and the question was, are they checkups still happening?
Yeah, so I wasn't sure about this actually when I originally saw it, but I've just checked with the divisional team who obviously cover those areas, and they confirmed to me that yes, we are doing cystoscopies, and that includes surveillance cystoscopies as well.
Great, thank you, Simon. Jane, I know that you had a couple of other questions you wish to ask. Now would be a nice time to come in on that, if that's okay.
Yes, thank you. So I'm thinking about people who maybe have a planned operation, expecting to hear a date for a cancer op or an urgent op. I know you said they were still continuing, but are they continuing at the same rate as they would otherwise, or might you suffer some further delay if that's what you're waiting for? And is the hospital having to prioritise in any way?
Yeah, so there's a lot of prioritisation going on, as you'd expect, Jane, and our clinicians have prioritised everybody who is waiting for an operation, and they're given a priority between one to 4. We at Newark, we continue to do patients with a priority of 2. Most of the patients at Kings Mill site are in the certainly in the priority 1 group. And a lot of those are patients who have their cancer, who are having cancer surgery. So we continue to do that. In the just looking at last week, we treated as many cancer patients as we treated in March this year. So it's sort of business as usual for cancer as much as possible. obviously we have to react to emergencies that come into our ED that need surgery as well, and trauma patients who also need surgery, and so we continue to do those, and where possible we'll continue to do patients who clinicians have identified as a lower priority. So yes, we're continuing to do it. It's under daily review, and it is always dependent on the level of the number of patients in our critical care.
Could I follow that up with one more, which is it was a bit more about people coming in for being an inpatient around discharge. So there's been quite a lot being around in the press about how people who still have COVID but might not need a hospital bed still, and where they're being discharged and what the arrangements is for that to be done safely. Could you explain that a bit more?
So,
oh, sorry, Simon.
Yeah, I can pick that up. So, and obviously it's a question for some of the providers of those onward services, but across the system there is additional capacity, and the priority is to get someone into their own home, and that is the priority for discharge, both in terms of their sort of reablement from their period of time in hospital, but also in terms of their isolation as well. So that's the absolute priority, to be able to do that. There is some designated capacity across the Nottinghamshire system for patients who are COVID positive who need bedded care post hospital stay, and obviously we still admit patients who are COVID positive into our rehabilitation community beds, so that'd be Sconce ward at Newark and Ward 33 currently at Kingsmill, but those beds are normally provided out at Mansfield Community Hospital. So you having COVID doesn't change the fact you getting into those beds. I think it is a challenge though, and I think that in the same way that Sherwood Forest have got a number of our colleagues who are self-isolating or who have got COVID and obviously off work, that is the same in Nottinghamshire Healthcare Trust, in social care and in other care providers. So there is a real challenge to make sure that the capacity is in place. And then likewise in care homes, where they've got equal challenges, and sometimes we're sort of blessed at Kingsmill. We've got like over 200 side rooms here, but it's not so easy in care homes for them to isolate patients. So sometimes those patients are having to have their isolation period in the hospital before they go to their onward care. So I think it's a complex jigsaw, making sure we get patients to the right place, but we're trying to do that, and our partners are trying to support us with that as best they can, Jane.
Okay, thank you.
Was there anything else from you, Jane?
No, let's make space for some last questions from the public.
Thank you. Yeah, just got a few minutes left. We have had a couple more questions coming back to vaccinations again, if I can do. Got one from Sylvia, who's just put a query in around the booking system. She says she's heard of people booking vaccinations appointment via the Swift queue, which is the link to book, before they've received a letter, and asks if this is correct. I guess, is that another one for you, Claire?
So yeah, so I can try and explain some of that. So as I said, the vaccination hubs in the hospital site went live at the start of December in order to mobilise the vaccination quickly, and the local vaccination centres and the vaccination programme per se sort of started a bit later. So some of what has happened is that booking links have been made available to members of the population that meet the criteria to be able to book their vaccine via that link, and some of that will have happened to ensure that everybody who is eligible for a vaccine, people should have then subsequently received letters, so that if they haven't already booked on, because communication hadn't got to them about the opportunity to book on. Letters have gone out so that we try and capture all of the eligible population to ensure that they know how to access a vaccination. So I think that's probably the explanation as to why some of that has happened.
That's great, thank you. And one final one before we let you off the hook. Is the I'm going to ask, is the second jab the same vaccine as the first?
In terms of the type of vaccination being used, then yes, that is the case. So if you the two vaccines that have been approved are the Pfizer vaccine and the AstraZeneca, and if you have a first dose of Pfizer, your second dose is Pfizer, and if it's AstraZeneca, likewise the second dose is AstraZeneca.
I was just typing an answer into the chat box about that.
Thank you, Claire. Just a couple minutes left, but just had a question coming from Councillor Craig Whitby, perhaps one for you to answer, Richard, asking how is the morale of staff and how are we keeping this up?
A very important question, and I think I can honestly say it's the thing that that myself and colleagues on this chat probably spend the most time talking about. We believe there's a huge relationship between the morale of people in the organisation and the ability to provide safe care. As I said earlier on, I don't think any of us should forget that COVID has been in our working lives and our personal lives for 11 months now. It has impacted on all of us. I think we have individually good days and bad days. In terms of the morale of people, I think it'd be fair to say it's mixed. I think people are, well, not I think, I know, people are tired, people are anxious, people are fatigued. An interesting word that some people use is people feel guilty, and you think, why on earth would you feel guilty? You've got nothing to feel guilty about. But people feel guilty about taking a 15-minute break in a 12-hour shift because they know that when they go to get some food or hydrate or use the bathroom, the colleagues are picking up the clinical load. People feel guilty about taking annual leave. People feel guilty that quite simply during COVID we're not able on some occasions to provide the very high levels of care that we would want to provide to patients. I recognise that sense of guilt in them, but I certainly don't think they've got anything to feel guilty about. So it's tough, but I can honestly say it might coming from a point of bias, but I think broadly speaking, as an employer, the vast majority of things that we can do to support people, I think we're doing. So I think communication throughout this has been really good. There's a whole series of wellbeing and welfare offers that we've put in place. We have got safe staffing. Julian and Dave and others check it repeatedly on a day-to-day basis. We have a food provision for colleagues across all 3 sites, etc. So there's always room for improvement. But I'm really proud not only of the response within this organisation, but also the way that we have supported people. And all I would just urge is, going back to my point about we've been living with this for 11 months, the reality is we will all have COVID in our personal and working lives for a number of months to come, who knows how long. And the 2 things that we can all do to support Sherwood Forest Hospitals is, one, ensure that we maintain hands, face, space in the way that we all understand, and the vast majority of us are complying that. And then secondly, hospitals are open for business. There's lots of people who need to be in hospital. We would urge people, if it is an accident, an emergency, or on a cancer pathway or other legitimate reasons, to come in. But when you come in, please treat the people who work at Sherwood with the dignity and the respect that they deserve, because they are working exceptionally hard to keep you safe.
Fabulous, thanks Richard. That feels like a good place to end. We've just ticked past 6:15, so I don't know if there's any sort of closing reflections or remarks that anyone wishes to make.
Jane, let's start with you. Anything you'd like to conclude with?
I would like to conclude by offering my thanks to you as a team and you as an organisation for really trying to do all you can in this really, really difficult situation. So thank you on behalf of the public for all you're doing. It is much appreciated, and really support your plea, Richard, that people treat staff with the respect that they deserve, and the gratitude really for everything that they're doing. So I think that's really, really important. Appreciate it's really hard. Appreciate that members of the public have lots and lots of questions about lots and lots of things, and there's not always answers to all of them, and you're kind of trying to make, you know, the questions are arising at the same speed at which you're answering them, and you know, we really appreciate that as well. So just thank you really for everything you're doing, and yeah, keep up the good work.
Thank you so much, Jane. Thank you for your support. I'll go to Claire and then Simon. Anything from you, Claire?
Just really to say thank you to all of our colleagues at Sherwood and in wider organisations across the system for everything that they're doing. And just want to echo that point, and just to say to our citizens to please remember just to stay safe and well. Thank you. Simon, then Julie.
Yeah, just to say thank you for your patience when you come into the hospital as well. I think all our colleagues are trying to give you the best care possible. It might take a bit longer while you're actually getting that care and stuff. So thanks so much. Try and be patient. Be as kind as possible to our colleagues, because they're all working hard and trying to do their best.
Thank you, Julie. Then Dave.
Yeah, just a thank you from me. We know that the vast majority of people in our community are following the rules, and that's helping us deliver the very best care for patients. So thank you.
Thanks, Julie. Dave, and then Robin. You're on mute, Dave. Been using MS Teams for 11 months now. I know you panic. I know you panic when it's a bigger audience, but we've supported you as much as possible.
You see, I was going to say, and just to thank you to Richard for the leadership that he's shown during this, but I'm going to scrap that now. I think probably building on all the comments we made, something about bearing with us. We are running an enormous vaccination programme, the like of which no one has ever seen before. And I think it would be fair to say that Sherwood is leading this across the county. So just bear with us and help us to help you.
Thanks, Dave. Robin.
Thank you. Thanks, Richard. Thanks, everyone. Lots of thank yous have been said, so I won't reiterate that. It's just really pleased that people can join us for this, ask questions, and we'll keep going with them as much as possible. So thanks for watching.
Thanks. To conclude, just building on Dave's point, so the vaccination programme has been rolled out at speed, and I think is going remarkably well, and that's testament to the work that we're doing with Nottingham University Hospitals, Notts Healthcare, primary care, colleagues in CCG and local authorities and beyond. So thank you everyone for your support with that. We don't always get things right. We'll be the first to acknowledge that. But I personally think, and there's a lot of evidence that supports that, I think across all three of our hospitals, we've got hospitals here that people can be proud of. We do provide safe care, and that's because people are working exceptionally hard. So thank you to the community for your support. I hope this call has worked for you. I hope that we've answered your questions. And I think, Robin, the plan is to continue with these until someone tells us that they're a waste of time.
I think so, yes.
Cool. Thank you. Have a safe evening, everyone.